Hi, I'm Liz Henry on faculty with NAIOMT. One of the most common mechanical dysfunctions at the elbow is the abducted ulna syndrome. And one of the most common causes of it is a fall onto an outstretched hand. And it is a very frequent predisposing factor to developing lateral epicondylalgia. That valgus force that occurs during the fall has quite specific effects at the elbow. At the medial elbow, the valgus force causes a gapping and a shifting of the ulna to the medial side, and you lose the normal lateral glide. At the lateral joint, the compression forces from the valgus and the compression force the radius distally down into the arm. When that happens, the wrist is placed into an ulnar bias, and the radial extensors overwork to return the wrist and hand to the neutral position, or more importantly, just give my hand a grip, more importantly, that important radial extension quadrant we require to grip something strongly. So the cluster of tests that you would use to identify this dysfunction is one, that there is, fully straighten this, that there is a greater carrying angle on the involved side than the uninvolved side. Good, and relax. And there is loss of lateral glide of the ulna at the ulnohumeral joint. That there is, just fold that there is loss of radial deviation compared to the uninvolved side. Hold your arm straight, fold your wrist down and take it out, and hold right here. And if you test the radial extensors, extensor carpi radialis, hold, and the brevis, hold, reproduce the lateral epicondylar symptoms. So what do we do for treatment? Lateral manipulation followed by taping to proprioceptively inform the joint. And you may also need to perform some manual therapy techniques to restore normal radial deviation at the wrist, although it may have cleared just with the lateral manipulation at the ulnohumeral joint. Additionally, you may need to use your favorite technique to calm down the soreness, whether it be needle, iStim, or some kinds of hands-on technique. You may need to have your patient avoid valgus activities to the elbow depending upon its level of irritability to get it calmed down. But all of that should set it up for you then to go in and work the entire upper quadrant on strengthening, stabilization, and motor control so that you can restore the patient to their full function and sport.